Bandages and dressings. We all know how they work and what they do. This medical technology has been around for thousands of years. It's a done deal. Sure, there's the occasional specialized variation, but in this day and the modern age, every possible permutation must already be accounted for, right? Well, maybe not. See, back in 2020, I wiped out on a motorcycle, and fortunately I was wearing all the gear one would expect, so my injuries were significantly lessened, but I was still left with some pretty serious abrasions on my hands, arms, and legs. A year later, in 2021, Katie, who is another Brella Health team member, had to deal with cellulitis as a result of skin cancer treatment that resulted in a 2-inch diameter leg ulcer on her left hip. After Katie and I had made a full recovery, we lamented about how it would have been nice if there had been a dome-shaped, raised, flexible bandage that would have covered the wound site without making contact with the injuries. Something that would have allowed the wound site to heal naturally, while also preventing infection and any pain caused from pressure-related complications. Those were the first musings that ultimately led to the foundation of Brella Health and our flagship product, the Bubble Bandage. From our shared experiences, Katie and I were initially setting out to create a commercial product that would target the general public and be sold in retail stores as an alternative to the conventional bandage. But after sharing the idea of the bubble with Elise, our third Brella Health team member, she shared that this product would have practical, meaningful, and immediate applications with packed wounds in a hospital setting. To confirm this, Elise undertook customer discovery by conducting anonymous quantitative surveys of nurses in the Allegheny General Hospital Medical ICU. From this, we learned that 78% of the nurses surveyed have had negative wound care outcomes as a result of using the flat, conventional bandage that's commonly used in treating packed wounds. And of those nurses, 100% believed that a raised, no-contact dressing would enhance the healing of these types of wounds. Furthermore, 89% of the nurses surveyed have had issues with the traditional flat bandage not covering packed wounds adequately, and of those nurses, 100% changed dressings more frequently as a result. With this information, we decided to specifically target the issues that can arise when treating packed wounds. Specifically, many of the issues are derived from the fact that packed wounds by nature are never flush with the skin. As a result, a conventional flat bandage will crease over itself when applied, creating weak points and putting strain on the adhesive. This may also result in the bandage not housing all of the packing material correctly. The issue is further amplified by the curved surface of the wound site and friction caused by movement from patients. Over time, this often leads to the wound being exposed. These types of wounds present a heightened infection risk due to the amount of exposed tissue, and as a result, frequent dressing changes are required. And here we have a prototype of our product, the Bubble. It is explicitly designed to address these issues. The Bubble is a dome-shaped, flexible silicone bandage that is designed to fit comfortably over raised wound sites, resulting in fewer dressing changes and thereby decreasing expenditure, saving time, and increasing patient satisfaction. The beachhead market for our initial product release will be hospitals in southwestern Pennsylvania, and that includes Allegheny Health Network and UPMC. The Bubble will initially be used by healthcare providers such as RNs, LPNs, and PCTs who are responsible for in-hospital dressing changes. Now, having said that, we see huge potential for this product or iterations of this product to expand to different markets. After our initial product development, we're planning to make a fully transparent bubble bandage that will allow for wound assessment without the medical providers having to redress the wound. Furthermore, the proposed bubble bandage that we're discussing at this time could be expanded to wider hospital use across different departments. It could be brought to urgent care, doctor's offices, and other care facilities such as nursing homes, LTACs, and wound clinics. It could be used by first responders such as EMTs and paramedics. And we do still see potential in a consumer market, both for traditional users and for those with sensory issues, since the bubble does not make contact with the wound site. We have identified a clear need for the Brella Bubble, and there are no competing bandages with our proposed design or use capabilities. We are extremely committed to bringing our vision of the Bubble to market through to a profitable exit. Thank you for your time and consideration.